Hello everyone. Today we're going to talk about the use of OptiFlow Junior from Fisher and Paykel in the treatment with using high flow in the neonatal environment. What we're going to see today is there an impact, or does flow have an impact on pressure, which we know, but what we'd like to see is how much impact does flow have on pressure. Oftentimes, if you look at all the data that is out there, more and more the therapeutic data is pointing that in a neonatal or a NICU environment, flow in a high flow setting should be set at 6 to 8 liters of flow. But what a lot of hospitals are stuck doing is between 2 to 4 liters of flow. So what we're going to look at is what does 6 liters of flow look like on a baby, and compare that to other types of interfaces, and hopefully get everybody more comfortable using higher flows for their kids. What you're looking at here is I have a baby with a test lung. This baby here is a 750 gram baby. It actually has a 3D printed airway within the system that is based off of a 750 gram baby. I also have an air source. This is just a simple air source that's going to be driving our liters of flow. And then I have some OptiFlow Junior cannulas from Fisher and Paykel, and then I also have a RAM cannula. On our simulator, what you see is an XY graph. The bottom part of the XY graph is going to measure our time, and then the side part here is going to measure our centimeter of water pressure. So I'm going to fix a cannula, one from Fisher and Paykel and compare it to one from RAM, and see what happens when we change the flows. So let's go ahead and get started. So my baby here has a pacifier in order to block the mouth leak. We'll go ahead and take that pacifier out later in the demonstration to see what impact that has. So I'm going to fix the Fisher and Paykel cannula to the baby's nose. Fisher and Paykel recommends a 50% or less occlusion when you're choosing your prong size. And when we turn this on, we're going to start it off at 2 liters of flow because that's a very common starting point in hospitals. And so if you could see here down at the bottom, a line has started moving across the screen, and that's measuring the CPAP that's going inside the lungs of the baby. So at roughly 2 liters of flow, we're getting about 0.3 centimeters of water pressure. Now, if you think of a scenario where a baby has moved from bubble CPAP or from ventilated CPAP and has now moved to high flow, a step down from, let's say, 5 centimeters of water pressure within a bubble CPAP all the way down to 0.4 is quite a heavy step down. And sometimes there's complaint that the baby is not doing well on the high flow. Well, it's not doing well because it's just not getting enough flow. So let's move it up to the recommended therapeutic range. As I stated before, it's 6 to 8 liters. So this baby is relatively small since it's 750 grams. Let's just move it up to 6, since that's the lowest therapeutic level. And as you can see, we're about 6 right now. And our centimeter water pressure has only moved up to 3 centimeters of water pressure, but that's good. I say only because if this was bubble CPAP again, it would be at 5 centimeters, and you'd have these rather aggressive vibrations, because that's what really makes bubble CPAP so great, are those aggressive vibrations. When you're going to high flow, you do have a little bit of CPAP. We're at 3, but what we're really trying to do is wash out the CO2. So it's just a different kind of therapy. But I'm pointing this out that if you are comfortable and you feel safe providing 5 centimeters of water pressure to your baby on bubble CPAP, then you should feel comfortable providing 6 liters of flow in a high flow type of setting with your baby, because it's not going to be as aggressive as a therapy. Now, I'm going to go ahead and lock that in, and let's see what happens when we take out the pacifier. I've taken out the pacifier, and we'll create a new line. And this red line at the bottom, that is the pressure that you're receiving when the pacifier or a chin strap is not used in a high flow type of setting. The reason for that is when a baby can self-regulate, they oftentimes will allow the high flow to pass out through their mouth and then it does drop off very quickly when you don't have a pacifier in their mouth. So let's go ahead and lock that as well. And let's take a look and see what happens when we switch from a designated high flow cannula to one that's kind of a tweener. This is the RAM cannula. It came out as kind of a do everything, being able to do both CPAP and high flow. In my other videos, I have a demonstration on how well it works in a CPAP environment. Not quite that effective in CPAP, but what you'll see with high flow is maybe a little bit too much. So let's take a look at that. So we'll attach here, click on the RAM cannula, plug that into the nose. Let's make sure that we're at 6 liters of flow. And let's get that pacifier back in there so we get a proper reading. And we're back up to about 6 liters of flow. And let's start a new line. And what you see here is the reason why it doesn't come immediately across the screen is the line for the RAM cannula is way up here. It's actually at about 9.5 to 10 centimeters of water pressure. The reason for that is because the RAM does recommend use of 80% occlusion whenever you're in a CPAP environment. But oftentimes when people move from CPAP to high flow and they keep using the same interface without resizing, then you get these really aggressive pressures, and that's when you start seeing 10 centimeters of water pressure at 6 liters of flow. So maybe that's what's leading to everybody moving down to 2 liters of flow, but it's nice to see that visually. Anyway, that is the comparison of the cannulas within high flow. It's best to stick with a 6 liter of flow on a cannula that does do 50% occlusion. And if you have any questions, go ahead and leave it in the comments. Thank you.